friends, I have here some foods and a supplement that could elevate your blood cholesterol and or fats within a few hours to days. Fat-free white bread, some butter, coconut milk, fried chicken that I have right here, and some walnuts. Which of these do you think has the most effect on the fat structure in your brain? Now, this is very different than using fat as energy. And which of these do you think can supply energy to the brain? So I'll let you think about these important questions because they are fundamental to understanding how to optimize your cognitive function, your mood, and prevent dementia. Now, do you think lowering your blood cholesterol will lower the cholesterol in your brain? Will that improve or worsen your brain structure? And does that depend on whether or not you have dementia? Now, let's think about all these answers together. So you will easily understand the answers to these really important brainy questions, no pun intended, if you understand which fats build brain structure versus which ones the brain doesn't need. And I bet the answers will surprise you. And in the end, we're going to go over 10 foods with essential fats that you can eat today to build your brain. So let's first all get on the same page. So this is a model of a brain I made. The average human brain is about 140 millimeters wide, 167 millimeters long, and 93 millimeters in height. So in America, we think in inches. So this is about 5.5 inches, about 6.5 inches, and then 3.6 inches tall. So it basically fits in the palm of my two hands. The brain is considered fully formed at the age of 25 with about 86 billion neurons. Now, this is made out of flour, but your real brain is fatty. But the fat only makes up 11% of your total brain weight. Now, water should be optimally about 75% of the brain's weight. And I know in my previous videos, I stated higher ratios of fat, which is different if you include or exclude the water. So between staying hydrated and eating fat, which do you think is more important for you to do on a daily basis first? I hope you said staying hydrated, because water actually freely passes the security gate of your brain called the blood-brain barrier, unlike many fats. Now, American presidents are always trying to secure our borders, right? But we all know it's still pretty leaky. But your brain has an extremely good barrier to secure its borders around the transportation highways, your blood vessels to your brain. And that is called the blood-brain barrier, which out-trumps the mountains of Switzerland and the Great Wall of China. That is how secure your blood-brain barrier is. And oftentimes the brain works like a teenager. Have you noticed that your teenager will do an excellent job when they're very interested? And well, your brain is really interested in water, so hence water passes freely through the blood-brain barrier, which is a great thing because when your tongue is dry, your skin is tenting, your lips are chapped, and your pee is dark, that means you're dehydrated and your brain is too. And nobody thinks clearly when they're dehydrated. So go get yourself some water and hydrate yourself well, because what we're going to talk about may be a little bit dense unless you're well hydrated. So first, reach down in your belly and pinch that belly fat. That, my friend, is pure energy, which you will never find in your brain. Did you know that your brain, it can't store any energy? The fat in your brain makes up its structure, but none of it is used for energy, which is a good thing. Otherwise, it may accidentally digest itself. Now, there are 5 main structural fats in your brain. Number 1 are phospholipids, which is roughly 30% of the fat. Number 2 are sphingolipids, which is roughly 25%. Number 3 is cholesterol, which is roughly 25%. Number 4 are polyunsaturated fatty acids, both omega-3 and omega-6, which is 15%. And the rest is mostly monounsaturated fatty acids. Now notice I didn't mention triglycerides, the fat that you're pinching right now on your love handles. The brain cannot store or use triglycerides directly, unlike the rest of your body, especially your belly, and that is why you can pinch it. You can store triglycerides inside and outside of the belly. So the fat that you're feeling at your love handles or giving you a beer belly, you're storing that for energy in the form of triglycerides. Triglycerides make up 80% of the fat cells composition, but are not in your brain fat. Your body, however, can break down triglycerides into ketones or glucose for the brain to use as fuel, as they are both able to cross the blood-brain barrier. And this is a good thing because your brain doesn't have its own power generator. It doesn't have a battery. Your body is a battery. So your battery, your body, has to constantly be feeding your brain energy molecules like glucose or ketones. But since it's unable to use triglycerides, if your triglycerides are high in your blood tests, you are overeating energy and calories, and none of that will get to your brain unless you break down your blood-brain barrier. And unfortunately, high triglycerides, they elevate your low-density lipoprotein levels, which are inflammatory to your blood vessels. They are considered atherogenic, causing inflammation, poisoning your immune cells called macrophages that line and police your blood vessels. The end result is a sick, foamy macrophage full of fat. And this thing swells up, causes inflammation. Well, basically, it grows into a pimple on your blood vessels. And these pimples, they grow larger and larger. They form scar tissue, which include calcium deposition. And eventually, they're so big, they will block the road, your blood vessels, preventing blood with water and nutrients to reach brain tissue. If this happens in any part of your brain for more than 5 minutes, that brain tissue will permanently die. And you will have significantly less than 86 trillion neurons. And this ultimately, over time, leads to dementia. This is vascular dementia, which is present at a microscopic scale in everybody with dementia. And hence, this is why we all need to get fat biology right. Now, I've read some of your comments, and some of you think that my fat biochemistry is outdated. Well, I'm happy to be updated if you can reference the PubMed articles that support your understanding of the roles of fats and mitochondrial health. And it would be helpful for me if you would leave in the comments the biochemical pathways and the references that support your understanding. I'm always up for learning something new. Now, when it comes to fats, social media has confused the fat that we use to store energy, your love handles, and your belly fat, with the fat that the brain needs for making the brain structure. They're all fats, and they are all similar raw material, but where they come from and how they function is not the same. It's like wood. You can find twigs that can burn energy, but you can't exactly use twigs to build your house, unless you wanted to live in a hut. In California, we don't use twigs to build our house. And if you did build your house with twigs, you'd be having a lot of holes and gaps, right? Bugs would come through, air would come through, heat would come through, and that would be a problem if your brain was that leaky. And hence we have a blood-brain barrier that prevents molecules like toxins as well as triglycerides from entering your brain. So triglycerides inside your body never makes it to your brain fat, which is a good thing because after you eat this white bread, your triglycerides will go up, even though this is fat-free. And your triglycerides will go up if you eat this fried chicken, or when you eat this coconut cream, or when you eat the butter. Like, all these things can literally change your fat metabolism or the fats in your blood pretty much within a couple hours of eating the food. And hence you want to fast at least 12 hours before you draw your blood lipid tests. And can you imagine the emotional roller coaster in your brain if it shrunk or expanded with your food preferences? Hence, the purpose of the blood-brain barrier is to keep the brain constant. If without the processed junk food people eat these days, there would be a higher rate of dementia if the blood-brain barrier broke. And guess what? I see people with broken blood-brain barriers quite often. And these are people who will be confused and demented, sleepy, lethargic, and they will remain so unless we can help secure their borders, repair their blood-brain barrier. Now, many social media influencers think low-density lipoprotein cholesterol levels are healthy for the brain as they supply cholesterol. Well, unfortunately, they're absolutely wrong, as blood cholesterol doesn't pass the blood-brain barrier unless it's broken. Then you have a more pressing problem. However, anyone with a high LDL, they're collecting lots of blood vessel pimples and plaques. And when they're big enough, they will ultimately block blood flow to the brain, which leads to microvascular ischemic events or tiny strokes in small vessels that go unnoticed. And if you block a big vessel, everybody will notice it. That's basically a massive stroke. I recently watched a video by a pretty popular social media influencer, and he says it's normal to forget things when we age. Well, I don't know who he's hanging out with, but that's not normal. If you're forgetting things, you need to work on your memory. It shouldn't be acceptable that you forget things. And if your memory doesn't improve with studying, that's a huge problem. And if this is happening to you, you should talk to your medical doctor to consider a MMSE test. the Mini Mental State Exam. It is an 11-question measure that tests 6 areas of cognition, orientation, registration, attention, calculation, recall, and language. Unfortunately, damage to the inside of the brain may be painless because the brain lacks pain receptors. Brain neurons and glial cells process pain as a sensory information, but they don't actually feel pain. And that's why brain surgery can be performed on patients who are awake. So which of these foods do you think will elevate your blood cholesterol? It's basically anything with saturated fat. So your butter, your coconut cream, your fried chicken will all elevate your blood cholesterol. And what's wrong with that? Well, if blood cholesterol doesn't go in your brain because it doesn't cross a blood-brain barrier, then how does your brain get the cholesterol it needs? Well, this is the beauty of how we were created. Your brain doesn't need to depend on the foods you eat, the cholesterol you eat, or the saturated fat you eat for it to make cholesterol. The brain makes its own cholesterol from acetyl-CoA. And you get acetyl-CoA by eating energy molecules. And a lot of social media influencers don't understand this. I bet they weren't really biochemistry majors when they were in college, and most of them probably have never done a lumbar puncture. That's how we collect spinal fluid to diagnose meningitis or encephalitis, which tells us that you have a leaky blood-brain barrier. Now, if you are collecting pimples and plaques in your blood vessels, then you have high LDL and is a guaranteed recipe for success. Success meaning blocking your blood vessels, which is not what you should strive to do. I am trying to do the opposite. I want to preserve my memory. My career is dependent upon a good memory, and I would say your career is too. I've been a professional test taker my entire life, and I pride myself on being an excellent lifelong student. But most importantly, I don't want to ever get dementia. And if you don't want to get dementia, then you really should keep your LDL within normal limits, because changes in your brain could be irreversible. And for some people, I admit it's harder to do because they absorb cholesterol very readily from their food. Other people don't clear cholesterol rapidly enough, and partially because they don't strive to poop. Pooping is the most effective way to clear cholesterol. Just poop it out. So if you have high cholesterol and you keep eating high cholesterol foods, well, you gotta poop more than once a day. Your cholesterol has a lifespan about 3 to 5 days in your blood. And it's the job of your liver to take it out, to put it in bile, and then that bile gets secreted in your intestines, where you have 2 options. You can absorb it back, or you can poop it out. So I strive to poop multiple times a day. And like triglycerides, I'm so glad that my brain doesn't depend on the fat in my diet to supply its own cholesterol. Because I try to eat a low-fat diet, and I certainly would be in trouble if my blood cholesterol dictated my brain cholesterol. I have worked really hard my entire life to have a low LDL cholesterol. And here's a couple of fun facts. 25% of your total body's cholesterol is actually in your brain. And let me repeat that. 1/4 of your body's total cholesterol is in your brain. But your blood cholesterol only holds up to 20% of your total body's cholesterol. So just by doing the math, you'll notice that there is no way that your blood cholesterol can supply an adequate amount of cholesterol to your brain. And you would literally be missing brain tissue if it was dependent upon your blood cholesterol. Your brain needs so much more cholesterol than your entire blood volume can hold. But what's even more important is that the blood-brain barrier doesn't even let that cholesterol in. And remember, this is protective because just like triglycerides, your body's cholesterol changes with your diet. This is why when you lay low on the saturated fat, your body will rapidly drop its cholesterol. And this is also why a newborn baby can have super low cholesterol levels in their blood and still rapidly grow brain tissue. The only essential fats your brain can't make are polyunsaturated omega-3 as well as omega-6 fats, which together makes up 15% of your brain's total fat. There have been observational published papers suggesting that low blood cholesterol is associated with a high rate of dementia like Parkinson's. Now, there are also several papers suggesting that statins can cross the blood-brain barriers and can cause cognitive impairment. The good news is it appears to be reversible. Now, this means that some people, when they take statins, the brain doesn't work properly. However, if you remove the drug, then their brain seems to come back. And we know this because millions of people have been on statins to lower their blood cholesterol. Now, remember, this isn't medical advice. So don't just stop your statin statins or any medication just because you heard me talk about it or any other social media influencer talk about it. But it is important to understand the connection between blood cholesterol and cholesterol-lowering medications like statins and dementia, because we have an astronomical climbing rate of dementia. And like most diseases, by the time somebody else recognizes that disease, it may be irreversible. Dementia happens 2 decades before people are officially diagnosed. Scary, huh? So if you're forgetting things, you really should go see your medical doctor.
Hi friends, I am so thrilled that you want to take charge of your health and take charge of your food. Now, I know nutrition can be complex, but it doesn't have to be. And I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes, and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now.
Now keep in mind, not all statins behave the same way because not all of them cross the blood-brain barrier. And remember, just because a medication lowers or increases your blood cholesterol, it doesn't necessarily mean that blood cholesterol level directly influences the structure and scaffolding of your cholesterol in your brain. However, the drugs themselves may do something to the brain. Statins that cross the blood-brain barrier are called lipophilic statins, such as atorvastatin, simvastatin, and lovastatin. They can inhibit the enzyme HMG-CoA reductase within brain cells, just like they do in peripheral tissue like the liver. And this could potentially reduce the local synthesis of cholesterol and CoQ10 within the brain. Now, the brain produces its own CoQ10, primarily in astrocytes and neurons. And it is especially concentrated in mitochondria within neurons that need a lot of help in reducing oxidative stress. Now remember, the mitochondria, they are the energy powerhouses of the brain, and they require CoQ10 for optimal function and protection against oxidative stress. However, brain CoQ10 production is limited by the availability of precursors like farnesyl pyrophosphate, FPP, which is derived from the malvinolate pathway. Now, you would think taking a supplement of CoQ10 would help, but unfortunately, blood CoQ10, even oral supplementation, does not cross the blood-brain barrier to benefit brain tissue. And like I said, the blood-brain barrier is very good at what it does. As long as the blood-brain barrier is intact, many toxins, infections, cholesterol, CoQ10, they won't be able to cross it. So which of these foods do you think will break your blood-brain barrier? And how do these foods break the blood-brain barrier? Remember how I said the blood-brain barrier is throughout your entire transportation architecture for your blood flow in the brain. So it's basically tied to the health of your blood vessels in the brain. So when you destroy your blood vessels, then you compromise your blood-brain barrier. And what destroys blood vessels? Many things, like clots or blood pimples. And remember, what makes more blood pimples? High levels of low-density lipoproteins, which is made to carry saturated fat as well as cholesterol. So it carries triglycerides and cholesterols. And when you reduce these blood fats, basically you stop eating them, the body will make more lipoproteins to carry them. They won't need to make them. Triglycerides and cholesterol, like all fats, they can't just travel in water because water and fat, they don't mix. That's basic chemistry. And your blood is mostly made out of water. So your body ingeniously made transportation submarines called low-density lipoproteins that transport both triglycerides and cholesterols in the same submarine. It's like buses shuttling people. Now, I have to drive in LA traffic, and sometimes the traffic is so bad that traffic barely moves. And in fact, in many days, I feel like I could probably walk faster than I can drive. Now, likewise, the more LDL lipoprotein submarines, the more congested your blood vessel highways get, so that you have a problem getting nutrients and water to your brain. And if you drive in LA, if you're in an ambulance trying to go through traffic, you know that you may not be able to save that person in time. And sometimes it's even worse when there's construction going on in the narrowing lanes that appears to be destroying the side of the road. And that is low-density lipoprotein. It blocks traffic, and then it destroys the blood vessel highways. The blood vessels narrows, destroying part of it through inflammation, the giant pimple, and it causes more oxidative stress. And of course, it's not just low-density lipoproteins that can cause this narrowing, this inflammation, and oxidative stress. Infections can do it, whether it's syphilis, Neisseria meningitis, the flu that you can get from people or in animals, or infected milk, or chickens, or Listeria meningitis from your lunch meat. So anything that causes inflammation in your brain blood vessels can weaken your blood-brain barrier, causing the tight junctions to have holes and gaps to allow more harmful substances to get inside your brain. I basically just described atherosclerosis, which is inflammation that starts as young as 7 years old. And it's basically a pimple snowballing into a giant boulder or a plaque that causes blockage. And this condition increases the risk of dementia like Alzheimer's and vascular dementia. Pretty much anybody with Alzheimer's has vascular dementia as well. Hence, abnormal blood cholesterol levels increase dementia risks, but not in the way many social media influencers think. People mistakenly think that low blood cholesterol is bad for the brain because your brain is made out of cholesterol. Well, they forgot about the blood-brain barrier and how the brain won't allow things that it doesn't need, like your blood cholesterol, to get inside your brain. It makes its own cholesterol supply. Countless studies have shown that if you reduce your low-density lipoprotein to a normal level, you reduce your risk of strokes and silent strokes that causes vascular dementia. And when your blood cholesterol does cross the blood-brain barrier, you probably have another problem. You probably have meningitis. The meninges are the protective sac around the brain. This disruption allows abnormal substances like cholesterol and other toxins to enter the brain. Inflammatory conditions can upregulate lipoprotein receptors in the brain, which might increase the movement of cholesterol or cholesterol-related molecules. And infections, they often trigger changes in lipid metabolism, leading to an increased cholesterol transportation that wouldn't normally be active in a healthy brain. And if cholesterol from the blood enters the brain abnormally, it contributes to more neuroinflammation, more oxidative stress, possibly worsening brain damage during meningitis. Now, it is also true that during an infection, your body just makes more cholesterol to keep up with the cellular replication of your immune cells, cell membrane repair, and the production of steroid hormones. But remember that blood cholesterol shouldn't be in your brain. With severe infections, your blood cholesterol may drop because your body is using it. And this is just explaining one mechanism towards dementia, atherosclerosis. Unfortunately, like I've mentioned before, there are multiple roads to dementia or a broken brain. And it's just like breaking your bones. There's more than one way to break your bones. You can trip in your home or on the street. You can be missing just one essential vitamin like vitamin D from the lack of sunlight, or maybe magnesium from the lack of eating beans and leafy greens, and you can fracture yourself. Or you can just live a sedentary lifestyle and then never exercise. That will break some bones too. Now, one of the most common neurodegenerative disorders in people over 60 is Parkinson's disease. And men are 1.5 times more likely to develop this condition than women. Michael J. Fox, probably one of the most famous people with Parkinson's, has an unusual case because he developed it at the age of 29. And notice his uncontrollable shaking. Parkinson's disease causes people to lose control of their movements. And eventually, they won't be able to move at all. And however, not everyone with Parkinson's develops Parkinson's dementia. And those without dementia probably have a more difficult time because eventually they won't be able to move their body, yet they are fully aware of that. So in the middle of your brain is called the substantia nigra pars compacta, which dies in Parkinson's. And these cells are responsible for producing dopamine, the same signaling molecule that drives reward, motivation, and learning. Dopamine is also critical for movement. And there are so many modifiable risk factors, including avoiding occupational exposure to pesticides and herbicides, traumatic head injuries, smoking, alcohol, inactivity, sleep disorders, and avoiding foods high in saturated fat, as well as low in antioxidants. Oxidative stress is a huge problem, and you will have it whether you eat or not. You know how when you leave your potato chips exposed to air, eventually it'll go stale, right? That's oxidation. So what does a stale potato chip taste like? Well, it's bland, tastes kind of cardboard-like, slightly chewy instead of crunchy. And when the oil oxidizes, it becomes rancid, adding a faint, stale, kind of musty, or even slightly bitter aftertaste. Oxidation basically changes the chemical structures inside your potato chip. And your brain gets oxidized whether or not you eat food because it's so metabolically active. And hence you have to eat antioxidants or your brain will suffer structural damages. And this is ongoing every second. One powerful antioxidant critical to your brain health is vitamin C. Vitamin C protects neurons from oxidative stress and free radicals made by your mitochondria. These damage your brain cells. Vitamin C is also a cofactor in the production of dopamine. It also aids the mitochondria function to help your brain produce energy. It improves the integrity of your blood vessels and maintains your blood-brain barrier and modulates your immune response to prevent neural inflammation. Even maldeficiency can affect brain health and mental function, and you may feel fatigue or brain fog. You may be irritable, anxious, depressed. You may have memory issues and real cognitive decline. You can have weakened blood vessels causing you to bleed. That can happen anywhere, including in your brain, and that will compromise your blood-brain barrier. It weakens your immune system, so you'll have more frequent infections. It'll decrease your energy. And severe deficiency results in scurvy. In very extreme cases, that can cause joint pain, internal bleeding, and even death. And how do we know this? Well, between the 15 and 1800s, scurvy was the leading cause of death among European sailors. It's estimated that over 2 million sailors died from scurvy. Some voyages lost 50 to 90% of their crew from scurvy. And the worst recorded case was in 1940, when the British Navy lost 1,300 out of 2,000 sailors on a single voyage. So in 1747, Dr. James Lind, he was a Scottish surgeon in the British Navy, he conducted the first ever randomized controlled trial to find a cure for scurvy. Now, he divided sailors into groups and gave them different treatments. Cider, vinegar, seawater, probably didn't go so well. Garlic paste, diluted sulfuric acid, or citrus fruits. And only the sailors who ate oranges and lemons, they recovered. Now, you would think that scurvy is an old disease, but actually it is predicted that up to 40% of Americans have low or borderline vitamin C levels. Around 7 to 8% of the U.S. population is severely deficient, putting them at risk for scurvy-like symptoms. And citrus really isn't that high in vitamin C. Bell peppers are so much higher. Now, groups at higher risk are basically smokers, because you deplete your vitamin C even faster when you're inhaling toxins. People with poor diets. So if your diets are full of processed food, heavy on carbs or fats, doing some kind of fast food diet or carnivore diet, well, meat contains no vitamin C. There's no vitamin C in these chicken nuggets. Bread or pasta has no vitamin C. And on top of that, excess iron from your meat equals more oxidation. And ironically, vitamin C increases iron absorption. So people with high iron levels, they increase free radical damage, and those with high stress levels, either physical or mental or emotional, well, that also depletes vitamin C. A typical American diet with fried chickens and some kind of bread or biscuit, this is devoid of vitamin C, and in fact contributes to brain oxidative stress in several ways due to the high levels of oxidized fats, refined carbs, and inflammation. See this brown color? That's not healthy. This brown color is called advanced glycation end products, AGEs. Fried foods, especially high heat cooked meats like fried chicken, produce AGEs that trigger oxidative stress and inflammation in the brain, contributing to neurodegenerative diseases like Alzheimer's and Parkinson's. Now, this fried chicken is probably cooked in a lot of vegetable oils. And when heated, these oils becomes oxidized, creating free radicals that damage neurons and the blood-brain barrier. And if you're eating processed breads, they also may have trans fats if they use fats in it. Trans fats are a type of unsaturated fat that have been chemically altered during the hydrogenation process to stay solid at room temperature. This was like the Crisco, the margarines, processed snacks, and fast foods. And unfortunately, trans fats are incorporated in the cell membrane, including those of the brain. They actually can cross the blood-brain barrier and accumulate in brain tissue. And trans fats are particularly harmful because they increase LDL cholesterol levels. They decrease HDL cholesterol, formerly known as a good cholesterol, and they increase inflammation in the body. They have been directly linked to increased heart disease, strokes, and dementia. And I think most of us have been exposed to synthetic trans fats because they were developed in the early 1900s when scientists discovered a way to hydrogenate vegetable oils, turning liquid oils into solid fats. Why did they do that? To make money. That extended the shelf life of their products. Remember the Twinkie? That increases stability of oils when used in high heat, such as cooking or frying. It improved the texture and consistency of processed foods, such as baked goods and snacks. How much margarine did you use to bake your biscuits and pies? By the 1950s and 60s, trans fats were widely used in the food industry, particularly in margarine, baked muffins, French fries, and snack foods. Essentially, if you're a baby boomer, you grew up on processed food, and you probably ate a lot of Crisco and buckets of trans fats. And trans fats, they don't accumulate in the body in the same way that other substances like fat-soluble vitamins. However, when you consume trans fats, your body metabolizes them and incorporates them into membranes, including your brain and your other organs. And over time, your body may be able to eliminate some of it, but that depends on your individual metabolism. Thank goodness they don't linger forever. However, the damage caused by trans fats to cells and our organs and our tissues, they can have long-term effects on our health. So the U.S. Food and Drug Administration, they officially banned partially hydrogenated oils, the primary source of trans fats, in 2018 after concluding that they are no longer generally recognized as safe. You can still find trans fats in certain foods, and they may still have an impact, particularly in processed foods and restaurant foods. Many of them haven't fully adopted healthier fat alternatives. So when you're eating partially hydrogenated oils, basically processed food, snacks, and fast food, or baked goods like cakes, pies, and pastries, and cookies, or fried foods like fried chicken, French fries, found commonly in fast foods, especially if you're eating margarine, well, these foods may actually have trans fats, and even if they don't, eating that amount of fat increases your body's insulin resistance, which actually is linked to Alzheimer's disease. Sometimes that's called type 3 diabetes. Insulin resistance occurs when brain cells no longer respond properly to insulin, and it also correlates to their response to glucose. And this is a big problem because glucose is a primary fuel for your brain. So if you want to understand how to prevent insulin resistance or reverse it, watch the next video.